The medical term for male breast enlargement is gynecomastia, dear viewers. There are several underlying factors that cause this, which is male breast enlargement. At the very top of these, and something we must examine and research, is whether there is a hormonal issue. Apart from hormonal issues, some medication use can cause breast enlargement in men. These are things we can naturally examine, research and find. However, another issue is that a patient sometimes reveals themselves immediately. The patient being overweight especially causes breast enlargement, and this seriously causes very significant problems and distress for men, especially socially. The inability to swim in the sea or pool during the summer months leads to a lack of self-confidence and psychological problems that cause very serious damage. Gynecomastia treatment is actually very simple. There is no need to be afraid. In gynecomastia, or male breast growth, there can be excess in two main components. The first is increased fatty tissue and the second is excess breast gland tissue. We generally determine and detect this more or less during the examination. However, I think that applying a combined technique in gynecomastia surgeries is very beneficial. Specifically, in gynecomastia surgeries, I start with liposuction to remove the breast tissue in the male, removing the excess fatty tissue in the chest area, and then I always prefer to assess the remaining breast gland in that region. After removing the fatty tissue, if there is a breast gland or milk glands during the surgery, they reveal themselves immediately. In that case, we make a very tiny incision from the normal skin border of the colored part around the nipple, making a tiny incision to reach the remaining breast tissue. We remove as much as we need from the body. I would like to explain why I emphasized as much as we need here. Because if we say let's remove everything in the chest area in these surgeries, as they say in the operating room, we may cause a depression in the area where the nipple and the colored part around the nipple are located. This is a situation that happens very often to our physician friends who are at the beginning of their professional life, or our friends with less experience. A common issue. In order for us to obtain a flat surface here, that is, not to cause a depression, especially in the part under the nipple, we need to preserve a certain thickness in that region. Otherwise, a depression or hollow will form. Therefore, by paying attention to all of these, by getting rid of both the fatty tissue and, if present, the breast gland, aesthetically, a fantastic result. This surgery takes about 1 to 1.5 hours. You can go home the same day. You must wear a compression garment for about 3 weeks. And for the edema and swelling caused by the surgery in the surgical area to pass, again, approximately 3 weeks. 4 weeks is more than enough for us. Our patients can start doing sports 10 days after this surgery. Our patients can take a bath 2 days after this surgery. Our patients can return to their social and business lives at most 3 to 4 days after this surgery. If you are wondering about the results, especially when you come for an examination, I can show you before and after pictures from other old patients so that you can clearly see that the result is super. I can show you. Gynecomastia, male breast enlargement, is not the destiny of any man. No man has to suffer this for years until he dies. Just decide and let us get rid of this problem for you in 1.5 hours.